Every year, many households experience a domestic fire like this one. Some fires result in damage to the property or equipment, but unfortunately, some cause serious injury or prove fatal. This is a reconstruction of an actual incident involving a lady called Sarah who was lucky to escape from the property.
Hello, fire service.
Hello, I'm calling about my neighbour.
So that's 3 Pine Way in Belfast, and what's the problem?
I can hear her fire alarm, but I can see smoke through her window.
Mobilise. Mobilise.
Echo 1203. Echo 1203.
After this fire in Sarah's home, she was admitted to hospital to be treated for smoke inhalation. Upon admission, a best interest meeting was arranged within the hospital, and one of the outcomes was to ensure the risks were reduced by carrying out a joint visit with Northern Ireland Fire and Rescue Service. Through partnership working, the fire crews were able to work closely with the Belfast Trust Older People's Social Work Service to reduce the fire risks in her home and facilitate a safe and effective discharge from hospital. Sarah was then able to return to her own home, which was made safer as a result of the multi-agency working between the agencies involved. The relationship between the Northern Ireland Fire and Rescue Service and the Belfast Health and Social Care Trust Older People's Social Work Service has meant that, 2 years after this incident, Sarah and others continue to live safely in their own homes. A key part of the Safer Together project is the development and implementation of referral pathways between the Fire and Rescue Service and the Older People's Social Work Service.
As Head of Prevention for Northern Ireland Fire and Rescue Service, my aim is to try and prevent accidental fires and fire deaths in the home. To achieve this, we engage in a range of community risk reduction activities, but we recognise that it's crucial to work in partnership and have partners in the community identifying people who may be at risk from fire.
Social work is fundamentally about improving and safeguarding social well-being, and our social work strategy emphasises this. We aim to support people to live safely, purposefully and well in their own homes, and working with our partner agencies to achieve this has always been essential to our practice.
Working in partnership with Belfast Trust's Older People's Social Work Service will broaden our reach and help identify those people at risk so we can try to stop fire from happening.
The promotion of well-being begins with safety, and Belfast Trust's Older People's Social Work Service, working in partnership with the Northern Ireland Fire and Rescue Service, can help to enhance and improve shared outcomes beyond what could be achieved in isolation.
The Safer Together project will aim to enhance the fire risk awareness and knowledge of health carers, family members, friends or neighbours who care for people in the community.
This enhanced partnership arrangement now can provide early intervention to identify, manage and mitigate fire risk with our service users. It helps people to have more control over their own environment by promoting honest and open conversations about the risk which fire poses to us all, and providing solutions.
By combining our resources and knowledge, we can work together to reduce the number of accidental fires and fire deaths.
The Safer Together project has been developed using a partnership approach. This approach supports staff in joint fire safety interventions and visits. It is a holistic approach which actively engages both the social worker and older person in helping them understand and manage fire risk. We believe the Safer Together model is transferable across all health and social care settings. We are safer together.
This video will show you what fire risks to look out for while working with service users living at home in the community and what to do if you observe any risks. It will also show you how you can work with the Northern Ireland Fire and Rescue Service to reduce the risks of the service users you visit. Sadly, many of those killed in domestic fires are over 50 years of age, live alone, suffer mobility issues, suffer from dementia, have memory difficulties and sometimes have an alcohol or drug dependency. As a social worker or a health and social care worker, you will be working with a group of people who are particularly vulnerable. Most accidental fires in Northern Ireland start in the kitchen. Remind people that they should never leave cooking unattended. Make sure the cooker or hob is turned off when service users have finished cooking. Encourage service users to keep the oven and grill pan free from a build-up of oils and grease. This could ignite and cause a fire. Keep flammable items such as oven mitts, tea towels, care records and cables away from the cooker top. Advise service users not to lean over cooker tops as loose clothing and aprons can catch fire. If you have concerns about the service user's capacity to cook safely, explore the options to reduce the risk. Fires started by smoking materials are the biggest cause of fatal fires in Northern Ireland. The best way to prevent smoking-related fires is to encourage service users to stop smoking for good. If the service user has capacity and continues to smoke, you can try to reduce fire risk by ensuring the smoker is using a proper ashtray, encouraging them to stub out their cigarettes fully, ensure they discard their cigarettes properly, remind them to avoid smoking in bed, recommend they smoke outside where possible. Be mindful that ashtrays balanced on furniture could be easily knocked over and encourage smokers not to balance cigarettes or cigars on the edge of an ashtray. Discourage the use of electrical appliances as an ignition source for smoking materials. Giving up smoking is not easy for everyone. If a service user is a smoker, a smoking apron is recommended. If there are issues around capacity, it is important to discuss the risk of smoking with a family or next of kin. A candle is an open flame in the home which will ignite any combustible material that it comes into contact with, including hair and clothing. Look out for candles on or near anything that can catch fire. Make sure candles are secured in a proper holder. Keep burning candles away from items such as furniture, curtains, bedding, carpets, books, paper, flammable decorations. Don't leave candles burning unattended. Encourage people to always extinguish them before going to bed or leaving the room. Encourage the use of a fire guard in the homes you visit. Look out for materials that could catch fire being too close to an open fire. This includes the individual standing or sitting too close to the fire. If the service user has capacity issues, open fires have an added risk. Many older people may turn on portable heaters to supplement heat during the colder months. Encourage the people you visit not to sit or stand too close to the heaters. Clothing may melt or even ignite. Never leave portable heaters unattended. Discuss the use of portable heaters while sleeping and recommend they are switched off. Do not dry clothes on portable heaters. Electrics and electronic goods are among the main causes of accidental house fires. It is important that plug sockets aren't overloaded. Although most extension leads allow enough space to plug in 4 appliances, this does not mean it is always safe to do so. 2 electrical adapters should never be used together. An extension lead or an adapter will have a limit to the number of amps it can take. More information regarding this issue can be found in the Safer Together training resources. Smoke alarms are vital as they provide an early warning of a possible fire within a property, allowing more time to escape. They can also alert neighbours, which was the case in the scenario mentioned earlier. There should be a minimum of one smoke alarm on every level of your home, positioned on the ceilings. Smoke alarms should be tested every week to make sure that they are working. If required, smoke alarms could be linked to an external source, like telecare assistive technology, which may be accessed providing the service users meet the criteria. If occupants have sensory issues, ensure a referral is made to Belfast Health and Social Care Sensory Support Team for the appropriate alarms. For older people you visit, it might be worth recommending extra smoke alarms for added safety. Smoke alarms could be installed in the room the occupant spends most of their time. There are many fire risks in the bedroom. Bedside lights, like this one, heat up if left on. Care should be taken to avoid the light being left on and try to prevent it from being knocked over onto the bed. Sticking the base of the light to the table would reduce this risk. Look out for devices being charged on flammable surfaces. Check the condition of charging cables and only use the charger recommended by the manufacturer. Devices should not be left on their own to charge. Look out for power leads that are frayed or damaged. Recommend they are replaced if necessary. Electrical cables under rugs, carpets or furniture may be damaged or worn, which could go unnoticed. Older people should have a bespoke fire escape plan tailored to their individual needs. A joint visit with Northern Ireland Fire and Rescue Service could help devise this plan. Fires in the home are a particular concern for people with capacity issues. Managing individual case risk can be done in partnership with the service user, their family, next of kin or a nominated person, as well as the Northern Ireland Fire and Rescue Service and other key agencies.
This production will help you identify the causes of accidental fires in the home and look at ways to reduce the risks, and hopefully it will assist and support you in keeping your service users safe from fire. My goal is 0 accidental fire deaths in Northern Ireland, and I believe we are safer together.
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 We are safer together.